Welcome back to another riveting video regarding pelvic health physical therapy and providing it in the virtual setting as a pelvic health physical therapy provider. We talked last time just about some of the benefits of virtual pelvic health physical therapy, and really today I want to dive into some of the myths that are misconceptions as to the limitations of pelvic health physical therapy in the virtual setting. And like we kind of talked about before, when I first got out of school, I was also on the fence about whether or not we as physical therapists, and specifically pelvic health physical therapists, could provide services with good quality care in the virtual setting versus in person. And like I mentioned before, my perspective has changed drastically, as I've grown as a clinician and gotten experience treating pelvic health patients. I have a much better understanding of what we bring to the table and how we can help serve these pelvic health patients just as well in the virtual setting. So for those of you who don't know who I am, my name is Taylor Kirk. I am a digital marketing consultant for pelvic health physical therapy practices and other related healthcare practices, and just a women's health advocate in general. And I'm very passionate about pelvic health. And so that's why I kind of wanted to continue this series on breaking down these barriers and these limitations to the mindset that we cannot provide pelvic health physical therapy in the virtual setting. Let's kind of jump right into the myths. We're going to go through 4 different myths today, and I'm essentially going to walk you through why these myths are not true. So myth number 1 is virtual pelvic health physical therapy services are less effective than in person. So here's the reality. Somebody that is way smarter than me, that has taken much more time to actually do research, collect data, and look into this myth, has found that outcomes of virtual versus in-person pelvic health physical therapy services are actually quite comparable. And as we've talked, online treatment platforms allow for real-time assessments, individualized treatment plans, and continued support from the provider, just as we do in the clinic. And this ensures that patients are receiving the care that they need in virtual settings as well as in the clinic without sacrificing quality. So this again kind of debunks that first myth of virtual services are not as effective, because that's not true. And the research is showing that outcomes are very much comparable, and we are able to provide the same quality care virtual as we are in person. Myth number 2, you need to be able to lay hands on the patient. Full transparency, this is where I first got hung up on the idea of physical therapy services being provided virtually. In my defense, I'd just come out of school, and so I had a hard time grasping the concept of what it felt like to be in the clinical setting, just learning and growing as a seasoned clinician, and what that actually entailed. And when you get out of school, you definitely are an expert as far as your entry level, and you're ready to treat patients and see patients and everything, but your clinical experience is minimal. So I think that's where my disconnect was, and getting into the clinical setting and actually treating for a few years helped me to better understand. So as I spent time in the clinic, if there are 2 important things that I learned during this time, it was 1, it is very, very possible that as the provider, you can have a good idea of what's going on with your patient sitting in front of you after talking to them for 5 to 10 minutes. And 2, observation of the patient without prompting them to do specific movements may also be one of the best clues that can provide insight into actually what's causing the issue. So the same is true for pelvic health patients, and can both be done in a virtual setting and an in-person setting. So while you're on a video call with a patient, so say you're a pelvic health provider who is offering virtual services, while you're on this video with your patient, you're going to observe how they move, you're going to assess their resting posture, and you're going to ask them the questions that need to be asked in order to know what it is that's going on. So you're going to find out what it is that they do during the majority of the day, whether it's work, taking care of a baby, or other things. And one of our biggest strong suits as physical therapists is being able to ask those right questions at the right time. And I'll never forget, in physical therapy school, my orthopedics professor, she had made this comment about how as providers, we should know what's wrong with our patient after taking their subjective information. So basically going through the process of asking them what brought them in, what their problems are, what they're struggling with, what makes it worse, what makes it better, so on and so forth. And looking back, at the time I thought she was crazy. I was like, how in the heck am I supposed to know what's going on with the patient if I haven't had them move for me, or I haven't been able to lay hands on them? But she was right. Like I said, as physical therapists, our subjective history taking is critical. And virtual assessments allow us to do the same patient interviewing and observation as does the traditional clinic setting. So moving into myth number 3, virtual services only work for certain types of pelvic health dysfunction. Again, this is false. From pelvic pain to urinary incontinence, sexual dysfunction, and prenatal or postpartum care, we have the tools to successfully assess and diagnose pelvic health patients. And this kind of goes back to myth number 2 as far as our interviewing skills and how we are strategic with how we go about interviewing our patient. But with proper physical assessment, using your eyeballs when you're on this call with the patient and asking the patient the questions that you need to know the answers to, you can absolutely diagnose and then treat many pelvic health conditions in the virtual setting, not just specific ones, not just a certain few. We have the ability to treat all types of pelvic health dysfunction that we're qualified to treat in the virtual setting as in the clinic setting. So moving on to myth number 4. This one is kind of one of my favorite. Myth number 4 is patients prefer in-person care. I just want to say, like, as a clinician, and I'm sure many practicing like in-person clinic providers can agree with this, like, do you know how many no-shows and cancellations that we get in the clinic setting? They couldn't make it to their appointment. You know, their car broke down, they had a flat tire, the weather was bad, or they couldn't find a babysitter. It's insanity. You know, life happens, things come up, and just like making that commute to the in-person visit is a lot of responsibility and commitment on the patient's end. Again, somebody else that's taken the time to provide surveys to patients, receiving virtual pelvic health services, and just dig into like the data of like the truth to this myth, they found that patient satisfaction is consistently high when they are being seen in the virtual setting for pelvic health services. Patients appreciate the convenience, the flexibility, the privacy offered that comes with virtual services. And you know, when satisfaction is high, whether it be virtual or in person, when patients appreciate the services that you're offering, they're so much more likely to participate consistently and adhere to the treatment plan that you've set for them. That's huge. One thing that I wanted to point out is, I like to call this a pro tip, but when you provide virtual pelvic health services, you really do eliminate a lot of the life conflicts that tend to happen and prevent patients from making it into the clinic. There is nothing wrong when somebody has to cancel their appointment, nothing wrong with when somebody has to reschedule their appointment or whatever it is, because again, life happens. But virtual pelvic health services, like I said, kind of eliminate these life conflicts, these issues that come up, whether car troubles, whatever it may be, not being able to find a babysitter, because they can do it right from the comfort of their own home. And I would say that like the other thing that's really important that I feel like is appropriate, you know, pending like how you and your patient work together, but be willing to see your patients with their children present. This can oftentimes clue you into what their everyday life looks like. You're able to observe movement patterns that may be contributing to their symptoms. So if somebody has to come to their virtual pelvic health appointment with you and they have to bring their newborn infant, this will clue you into what their sitting posture looks like. Are they baby wearing? Are they carrying the baby? What does that look like? And it can really help you kind of decipher maybe some of the root causes to what's going on in the dysfunctions that they are experiencing. I know this was kind of quick and short, quick and dirty, but like those 4 myths are just like, we need to be open-minded and we need to wrap our brains around the fact that a lot of things in this world, including healthcare treatment and interventions that we can provide, they're going virtual. They're going to telehealth. In conclusion, virtual pelvic health services, you know, are proving to be just as effective as in-person care. Research and experience are showing that these services offer quality through real-time assessment, tailored treatment, and ongoing support, ensuring that the patient gets the care that they need, just as they can in the clinic setting. Patient satisfaction, once again, is very high, thanks to the convenience and flexibility, which eliminates common barriers and life conflicts that prevent them from accessing treatment. And by embracing these virtual services, clinicians can gain valuable insights into patients' lives while providing effective care, allowing us to have a promising future of improved accessibility and patient-centeredness for our pelvic health patients. At the end of the day, if you are a pelvic health provider and you think that virtual services are not the route you want to go, that's absolutely okay. I would just encourage any pelvic health provider out there to at least consider and look into offering these services and how they could potentially benefit their patients by doing so. So I hope this video was helpful. I really just wanted to get on here and just like debunk those 4 different myths that I found that are very common when it comes to questioning whether virtual pelvic health services are good or bad. Again, my name is Taylor Kirk. I am a digital marketing consultant for pelvic health physical therapy practices and other healthcare practices. So if you would like more information about what I do and how I can potentially help you in your practice, I will link my website below and how you can get a hold of me below in the description. And stay tuned for more video content related to virtual pelvic health services.